right, that was a much better intro than the top of the hour. Johnny K and I profusely, I'm so sorry. Producer Nick, you are definitely missed today, buddy. We've got producer Lizu in the house, rocking it. Hope she is doing great. Thank you so much for all your help. We're not going to do the YouTube page, but anyway, if you ever wanted to see the YouTube pages, it's www.watr.com, and you click on the YouTube link. The reason we've been doing the YouTube is for compliance. I am not selling insurance over the airwaves. I am actually just educating. So here is the education part. Dr. Zimmerman, an open letter to all my United Healthcare patients. Another letter from Jack Larson, CEO of United Healthcare, Medicare and Retirement. Seniors, I cannot stress this enough, and I hope the board gets lit up. Don't say your name, but I know you have questions. 203-757-1320. Yes, it is a bit of a disaster to be an insurance agent with Obamacare kicking off and annual election period kicking off. Annual election period, for those of you that don't know, it's October 15th through December 7th. You have to make a change if you decide to. This is the only window. If you'd like to disenroll from January 1st through February 14th is called Medicare Advantage disenrollment period. So a little tutorial here. My buddy Chris is always telling me I got to keep these segments to a smaller window. What is a Medicare Advantage? When you purchase, and it's not free, it's zero monthly premium. A lot of people say, I have that free one. Zero monthly premium. When you purchase a Medicare Advantage plan, whether it be from Aetna, Anthem, United Healthcare, or Connecticut, you are giving up Medicare. You are going on a private insurance carrier's network. That network is a network of doctors and a network of hospitals. So you essentially are giving up the 80% that CMS, Centers for Medicare and Medicaid Services, they're funding 80% on a Medicare supplement or a Medigap policy. With Original Medicare, the 80%, Original Medicare is paid for with your dollars. You worked 40 fully satisfied quarters, therefore you qualified for Part A. You have to purchase Part B. For most of America, it's $104.90. If it's higher, which is referred to as an IRMA adjustment, good for you. It means as an individual, you make more than $70,000. As an individual, you make more than $85,000, and as a married couple, $170,000. Again, higher than $85,000 for a single, married couple filing jointly, $170,000. So pat yourself on the back if your Part B premium's higher than that, $104.90, because you're doing well. So you and your family, you and your spouse, you alone decide to go on a Medicare Advantage plan. Why is United Healthcare dropping doctors? People are asking me that question more than 300 phone calls a day. And honestly, girls at the office, Jean, thank you so much. I know you're stressed. Kristen, you're staying till like 6:30 ladies the other night. I really appreciate all your hard work. The new intern, Ryan's doing a good job from the community college. Anyway, we cannot stop the phone calls, and I have a couple more employees, but they're basically coders and stuff like that. Don't ask my dad, Bill. He's just the owner. When a carrier is being reimbursed from CMS, Centers for Medicare and Medicaid Services, every paperwork must be coded properly. ICD-9, and in the future it's going to be ICD-10. Everything needs to be done properly with a procedural code. The doctors need to file the procedural codes to the insurance carriers. The insurance carriers do not get reimbursed fully if their paperwork is not in order. That is the reason for the massive 2,000 plus, Johnny K., massive 2,000 plus disenrollment of physicians. So Jack Larson put a letter out in the newspaper. Apparently went to the Hartford Courant, the New Haven Register, hopefully our great paper, the Republican American. And Elisa, great job with my ads. Elisa and Kristen in my office did up some nice ads. You should see G.S. Regan ads in the Republican American. Really well done. The graphics are good. I like the color. I'm a little bit of a control freak, so when you do something right and I like it, that's a good sign. So basically, Jack is trying to say our mission is to offer access to high-quality, affordable care. Well, yes, they do offer a great product. United Healthcare has a great product. Aetna has a great product. We are not allowed to say the best. It is a test question. We are allowed to say a good carrier, a strong carrier, a well-rated carrier. Connecticut, always quiet and always, you know us by heart. They're good. They're a local company. They do a great job with service. Obviously, it's an important topic because clients need me. Michael Regan, line 1. How can I help you?
Mike, how are you?
Good. Nice to hear your voice.
Listen, I got a question for you.
Okay, no names for HIPAA. Go ahead.
Is there a cutoff period for people that are Medicare Part A and Part B? I seen something on the internet last week, and I was going to call you, but I didn't have enough chance.
How young are you?
Well, I'm 70. So I'm going to be 76 in February.
There's no cutoff period. If you're disabled and you have Medicare A and B, which means you're under 65, you can only get a Medicare supplement that is Plan C. That's on a supplement side. You can get any Medicare Advantage plan. The A and B you must have. You must continue to pay the premium for Part B. And the open enrollment window is now. From October 15th through December 7th, you can buy and start January 1st, 2014, any Medicare product or change any Medicare product in this window.
Well, the reason why I'm asking that, because I looked on the internet and some lady wrote in on the internet that she had just got cancer, and she's looking for Medicare Part A and Part B, and they said they no longer insure after a certain age bracket. That's why I'm asking you.
No, it's end-stage renal disease. If you get end-stage renal disease, you are not eligible for a Medicare Advantage plan. The woman has to get Part B. Did the woman have Medicare Part B?
I'm not sure.
Okay, so, well, for the generic question, it's actually a great question because I'm sure it's on people's minds. If you get cancer, you cannot be turned down. In the state of Connecticut, it's a guaranteed issue state. There is a chance that woman, that lovely woman who got sick, is not from Connecticut, so there's underwriting.
That answers the question. She's not from Connecticut.
Correct. So underwriting means that the carrier has the right to deny the coverage. One tip is the person could relocate, get an apartment for 6 months or longer. She will therefore become a resident of the new state. As long as it's 6 months or longer, she would get care. Secondly, with health care reform, Obamacare, but it's really called PPACA, Patient Protection and Affordable Care Act, she can go on to one of the exchanges, doesn't matter what age it is, and she will be eligible for insurance starting January 1st, 2014 on a guaranteed issue basis.
So if a person over 75 or 76 is in that situation and they live in Connecticut, they should actually keep residence here.
Correct.
Part-time residents if they're going to Florida or something else.
No, keep the state of Connecticut driver's license. Keep yourself here for 6 months and 1 day. You must be legally 6 months or longer as a resident. And Connecticut is a guaranteed issue state. They can always buy one of the Medicare Advantage plans. There's a lot of good zero premium plans. Or in this case, with the cancer, it's sort of a better option to get the Medicare supplement. As long as it's a small cancer, Advantage plan works fine. But severe cancer, where you're going to be getting chemo, radiation, many doctor visits, the better plan is a Medicare supplement because it's zero copay to the hospital and zero copay to the doctor. With an Advantage plan, you have a zero monthly premium, but you pay copays when you go into the hospital and you pay when you go in to the oncologist. So you'd have to weigh your options there.
Yeah, I hope somebody helps that lady out. Thank you, Michael.
Hey, good question. That was an easy one. All right, so any questions? The lines are open. I'm going to continue to rattle on. Johnny K., what do you want to take a commercial break at around 140, 142? All right, so we've got time. Again, I have to stress this because it's important. Why is United Healthcare doing this? It is not your doctor's fault. It is not your carrier's fault. It's a miscommunication. So I am not an attorney. I don't give legal advice. I'm an insurance agent. I can advise you on what we've been told in our multiple producer meetings. They have said, United Healthcare have said that the reason they disenrolled the physicians is because they're not getting the reimbursement. Now, you're going to ask me, you're scratching your head, what do you mean reimbursement? When you go on a Medicare Advantage plan, CMS is no longer on the hook for the 80%. So they are funding this with a stipend. Stipend meaning you're 65, you're young and healthy. It's a very minimal $500 to $600 per month. The older you get, depending on your zip code, and the sicker you get, it's up to $1,100 per month per member. I'll take the caller and I'll continue on. Thank you so much for listening to the show, Michael Regan. How can I help you?
Yeah, this is just a quick question.
Sure.
I'm getting feedback here because the radio's on.
No problem. We can hear you beautifully.
For many, many years, I worked, full-time for a small business. Me and my husband, he was self-employed.
Okay.
And we have payroll. We have guys on payroll, but I never put myself on payroll because I didn't want to double the Social Security.
Sure, I know exact net 15. I know exactly what you're saying.
Okay, the question is very simple. Now, I don't have the points in. So I don't have enough points in. I know I could get the Social Security from my husband, a portion of his, but what about Medicare?
Okay, you need to have 40 fully satisfied quarters or 10 years of banked. Points is a great term. It's actually called credits, but points, I know exactly what you're saying. So you're how young?
I'm 60. I'm going to be 64 in January.
Okay,
January 3rd.
64. Do you have a pen?
Yep.
Okay, are you ready?
Yep.
1-877-405-4874. Again, nice and slowly. 1-877-405-4874. Are you super internet savvy or do you like people?
I'd rather have a person.
I like people as well. I love people, actually. I don't love the internet. I can figure it out, and I know the girls are laughing to me at the office right now, but I like the communication. I like to get someone's name. I like to get a little confirmation that, yes, this is exactly the question I asked, and they answered it. So you're going to call the Social Security Department. Don't give your name or anything over the airwaves, but you're going to say, hi, I'm Jane so-and-so, and my Social Security number is this. How many credits do I have? Then,
well, I know the credits because they send you that thing in the mail, and I know there's not enough.
Okay, how close are you?
Oh, God, I worked when I was a kid. We started this business when I was 18.
Okay, so
and now
you
I'm
can
64.
buy into it.
Huh.
All right, 203-757-6099 is my agency phone number. Give me a call, and I will help you. I'll walk you through everything, and it'll be easy peasy lemon squeezy. I'll take care of it.
Okay, repeat this, 203-757-6099.
I was actually told by a friend to say 6099. It's easier for people to remember two numbers instead of four.
You're right.
203-757-6099.
Yep.
Talk to you soon.
Okay.
Have a great, thanks for listening. Can't stop the calls. Love it. At least gets that board all lit up. All right, Michael Regan, how can I help you?
Yes, Michael. Sorry about calling back, but I had one other question.
Oh, I love it. I love the calls. Sure.
Excuse me.
Bless you.
I'm 64, going to be 65 next July.
Okay.
How soon shall I look at signing up for Medicare?
Okay, so 7-something-49 is your date of birth, right?
Yeah, July 8th, 49.
July 8th. You get 3 months before, the month of, and 3 months after to enroll. This is referred to as initial coverage election period. So, April, May, June, the month of July, August, September, October. Do not let those months go by without turning on your Part B. Are you good on the internet, or you like people like me?
Oh, no, I like people, but I'm good on the internet, too. But,
okay, you can either go to 51 North Elm Street in Waterbury. They're all lovely down there. Or you can go on to www.socialsecurity.gov sometime in late April. Turn on your Part B. Are you going to retire yet?
No, not really. I'm planning on working a few more years. Now, here's the other thing. My wife's a school teacher. I'm on her insurance presently.
Through the Board of Education? Through the
Board of Education in another city.
What city?
Cromwell.
Cromwell may have gone to Cigna recently, but notoriously it was always Anthem.
Okay, well, I know we're under Connecticut for insurance.
Okay, so Connecticut is your primary. You do not need to turn Part B on until your wife fully retires, because Cromwell's clearly more than 20 full and part-time employees. So you have Connecticut as your primary. You do not need to spend $104.90. You don't need to do anything until she retires. Did you marry a younger lady?
Well, she's 3 years younger than me.
Okay, so you're 64 now. That means she's 61. She's going to at least go another 4 years. Hold off. Don't waste the money. And you can collect Social Security at 66 2/3. It's the best time for you.
Okay. I was hoping to get towards 70, but...
okay, you could, but make sure you look at the numbers. The equilibrium really peaks at 66 2/3. Those extra couple years, unless you're a big bread earner, doesn't make the check that much different. Is your income, you and your beautiful wife, more than $170 a year?
No.
Okay, so no. Take a look at the grid on socialsecurity.gov and figure out your optimum time to collect Social Security, and then call me in 3 or 4 years when you're ready for a Medicare product.
I appreciate your help, Michael.
My pleasure.
Good afternoon.
That was an easy one. Bye-bye. All right, caller on line 3. Thank you so much for patiently waiting.
Hello?
Yes, good afternoon.
Mike.
Yes.
This is Elio.
Elio, no last names. How you doing, my buddy?
Not bad.
Great to hear your voice.
I have a doctor that's not going to be in for next year.
Okay, don't say the doctor's name. Don't say the physician's name.
No, I understand. I called the office, and the secretary, or whoever takes care of,
the physician's office. Office manager.
She said they're going to be in it, but I called the insurance company, and they said he's not going to be in. So my question to you is, if they're going to, right now they're going to be out, could they come back in?
Absolutely. What's happening is there's just pure pandemonium right now. It was such a shock that they got a letter saying you're disenrolled. What needs to be done is paperwork. It's such a litigious society these days. It's sad, but paperwork was not properly filed, so the reimbursements from CMS were not satisfying United Healthcare. They weren't getting their due diligence or their proper amount of money. So the ones that were giving United Healthcare a problem, they just disenrolled them. What I will do is have you wait at least till later in November to see if this is fixed. If not, I hate to say it, you'd either have to find a new doctor, which I don't recommend because I'm a big believer in the doctor knowing you, or we'll have to find another Medicare product, whether it be a Medicare supplement or a Medicare Advantage. With a Medicare supplement, there is no directory. As long as the doctor participates with Medicare assignment, he or she, the physician, or the hospital must take you. As long as they participate with Medicare, they must take you. When you go on an Advantage plan, you have to stay within the network. So
yeah, I know that, yeah.
Let this play out. God bless you. Thank you so much for being a client, and I will see you in a couple weeks at the office.
Okay.
Bye. Ciao. Arrivederci. Commercial break. Johnny K is saying, I'll be back in 2 minutes. Thank you so much for listening.